The word of the day in healthcare is consolidation, consolidation, and consolidation. We're used to what we call horizontal integration, which is mergers between, for example, hospitals and drugstores and sort of like entity. What we're seeing now is this vertical integration where you're seeing basically the top PBM in the country, which is run by CVS Health, wanting to buy the fifth largest insurer, that's Aetna. You're seeing the second largest PBM, which is Express Scripts, being acquired by the seventh largest insurer, Cigna. And already the third largest PBM, OptumRx, is owned by the number one insurer, United Healthcare. So what we're seeing is really some fundamental change that we've never seen in healthcare before. We're seeing all of a sudden the idea that Amazon may getting into the act. And if you're an Amazon Prime customer and you're used to getting your product a day or two later, imagine the same thing holding for your drug. You're all of a sudden seeing Walmart talking to Humana. So we're seeing something that's really unprecedented in healthcare. I've gone back to the 90s when managed care was going to rule the roost. There were going to be no physicians, it was just going to be managed care. Now we're talking about something that's fundamentally different, and that's that you're having different parties merging and getting together. And the problem with that is that all this consolidation in healthcare has only produced one thing: higher costs, and in some cases less accessible medical care. So I think that this is something that we really need to watch, and something that I think you're going to see more of going forward. Well, I think the first thing that the federal government has been looking at, specifically the Trump administration, is some of the drug price side. They're supposed to come out with some more things on drug prices now that Secretary Azar is in place. Obviously, the rebalancing of 340B cuts was put up as saving patients more in terms of some $310 million in 1 year alone, 2018. And I think that now they're looking at these rebates on the PBM side and going after those as well too. But I think we're going to see a lot more come out that has to do with sort of controlling drug costs and even going after drug prices. I think it's just inevitable given the promises that the president has made.